Muscle-based therapy, we're looking specifically at how muscle can impact on nerves and blood flow. In the concussion case, we're looking at how muscle connecting to other tissue can contract, pull on that tissue, and impact on cranial nerves and cranial nerve function. But you also have to consider what is the blood flow like to the brain, because if there's inadequate blood flow, it can't heal, nor can it function properly, even if it isn't necessarily injured. So when we do that, you can actually see specific changes when you work with specific muscles. So you can actually really demonstrate very, very clearly that this muscle, if you work with it, it will alter the function of these cranial nerves. Or if it's a foggy brain, if you increase the blood flow. So if you work on the muscles that surround specific arteries, the blood flow increases and the brain function improves. We are different than other physio clinics, partly because I'm a physiologist, neuromuscular and cardiovascular. So I will always bring things back to straight anatomy and physiology. If it doesn't meet those criteria, I don't necessarily accept it. So a lot of places give stretches, but if it doesn't stretch out fully, you're never going to get the full endurance back. So the person becomes stuck, and then you often hear people that have had concussions and they suffer for years and years afterwards. No, the goal is to make it better so that you can actually get the muscle strength back, to get the normal blood flow back. Now, there's biochemical pathways, and in teaching some physical therapists, I've had people say, I don't want to know the biochemistry. If you do not understand the biochemistry and why it occurs, you will never be particularly good at actually even performing it. It isn't a paint by numbers approach. It has to be thought through clearly and concisely. Unfortunately, that is not the way it's taught. People are taught just to think of the specific exercises. It's far more than that. The TM20 device I developed so that you could relax the muscle and increase the blood flow. So what I wanted was something, and I've tested this on animals and then on humans actually, that you could actually test it to demonstrate if you use specific frequencies, you don't have to contract a muscle at all. And I don't want to, because when you have something like a concussion where there's been a very severe spasm, and usually I'm dealing with people long after the fact, they don't have the endurance. So if you over fatigue the muscles by contracting them, they will have a rebound contraction, which will make the person feel miserable, which is why TENS isn't used for concussions. Typically, we used to hear it being used occasionally, but it exacerbated the symptoms just terribly. I do not want the muscles contracting. I want them to relax. I want to increase blood flow, and I specifically want to alter one biochemical pathway. It's the most potent inflammatory pathway in the body. There's a report or a paper that's going to be published very shortly, actually, where they did a double-blind study on myotherapy versus myotherapy and exercise. And they found there was a very significant improvement in the cognition solely by using the TM20 machine by itself. Now, nothing's been shown to do that. And yet, just the machine, even without the exercises, has a dramatic impact on cognition. One of the greatest problems after a concussion. MMTR treats many conditions. But for all of them, we use this MyoWorx approach. And that's what's key. So it allows us to often find what are the really underlying problems that other people can't necessarily identify. Let me give you a simple example. Plantar fasciitis, pain in the sole of the foot. It's a very common problem. And people often get orthotics, which is a Band-Aid to take the symptom away, but it doesn't correct the problem. So people will go for extended periods, stretching the bottom of their feet and stretching their calves and so on, which is all very good because it does stretch and eventually the pain starts to decrease in most people, not everyone. But what they don't realize, why did it suddenly tighten? No one asked the obvious question. Why? What you'll actually find is if you use it on the back and then stretch the lower back, the plantar fasciitis pain goes away immediately. So they're not even looking in the right area. People think assumptions are made based on long-held beliefs, not on ongoing research. In my view, everything can always be made better and faster, and that takes ongoing research. And that's just one example. I can think of many examples. So yes, we deal with a lot of chronic pain issues, and we use the MyoWorx, which is the real key. That has allowed us to determine the real processes in action versus what seemingly are the way these things work. So thanks again for watching Terry Talks today. Hopefully it's given you a few more answers, or at least made you think about things a bit differently. So thanks very much again.